topic is looking at the use of metered-dose inhalers or MDIs versus nebulizers for treatment of respiratory illnesses in pediatric population.
We are looking more closely at asthma. We narrowed the topic down to asthma because it is the most prevalent respiratory illness worldwide.
Hi guys, and welcome to our discussion on nebulizers and MDIs. Today we are going to introduce you to our topic, explain the purpose of metered-dose inhalers and nebulizers, why this topic is to be re-examined, how to properly use these devices, and why this is applicable to nursing care. MDIs and nebulizers are the main treatments for asthma exacerbations in pediatric populations. Asthma is the most prevalent respiratory illness. Nebulizers are currently the standard treatment for asthma exacerbations in pediatrics, and 235 million people currently suffer from asthma. We'll be discussing two methods of administration for treatment of asthma, the metered-dose inhaler and the nebulizer. A metered-dose inhaler, or MDIs, are portable and can be used at home and with a spacer or face mask for better drug administration. They are quick to use and children can be taught to self-administer. MDIs also require patient education. Nebulizers, on the other hand, are used to administer liquid medication. It creates a mist, adding moisture to the air for better particle distribution and uptake. Nebulizers are the most common way to administer inhalant medications. It allows the caretaker to administer more than one drug simultaneously at higher doses. Administration times are longer and require a power source. So why do we need to re-examine this topic? We need to re-examine this topic because the use of nebulizers in the emergency department is a standard treatment for asthma exacerbations. The use of nebulizers are proven to be effective due to their higher compliance. With this increase in confidence in nebulizers, there is a decrease in MDIs. This is also a result of poor teaching techniques of MDIs and therefore the misuse at home. This leads to increased emergency department visits for each exacerbation, thus completing a vicious cycle. So why is this important for our pediatric patients? Primary research shows that nebulizers are not necessarily more effective than MDIs. They are found to be equal in effectiveness. Nebulizers allow the administration of different medications while inhalers are one medication per inhaler. However, using inhalers one after another is still found to be faster than using nebulizers. Metered-dose inhalers are also less costly for patients and hospitals. They are less stressed for the patients and their families, and patients will not need to be removed from the regular routine and environment as often. This will lead to parents not having to take as much time off of work to make more frequent emergency department visits. The use of metered-dose inhalers are able to build capability. Another important thing to consider is when patients are always discharged from the hospital with an inhaler for home use. The use of an inhaler at the hospital can provide guidance and teaching that is more beneficial for the family. By teaching children how to use their MDI correctly, they are able to intervene when early symptoms occur, preventing visits to the emergency department. We want to encourage patients to take control of their health. By changing the way nursing care is performed, we can educate and work in an upstream approach. So let's look at the evidence. Studies have shown that MDIs are just as effective in achieving therapeutic effects as nebulizers. According to Kwok and Chan, MDIs and the use of spacers have shown to have earlier resolutions of wheezing, few days of cough after attack, and shorter absence from school. There is a higher incidence of adverse effects in nebulizers than in the use of MDIs. MDIs are readily available and can be used by patient without even visiting an emergency department. So how does this all work? Since spacers provide a space and time for particles to decrease in size, the lungs have a similar function. The travel time in the airway allows particles to evaporate and reduce in size. As the particles decrease in size as they travel to the lungs, the gas exchange at the alveoli require the particles to be very small. According to the research done by Kwok and Chan in 2014, using MDIs with spacer increases the absorption of the medication. What does this mean for nursing practice? We as nurses need to identify the need for education, assess the patient and the family's knowledge and feelings about MDI use, allow the patient to use his or her own MDI at the hospital so that we can provide tips around MDI techniques. We need to develop a teaching plan on proper MDI techniques. By increasing teaching on proper MDI techniques, develop a teaching plan with the patient and a family member and recognize their needs. We want to instill confidence with our patients. Implement the plan, instill confidence in our patients around the MDI use, and evaluate the result of teaching with the patient's family. Create a workplace culture using evidence-informed practice. promoting the culture of seeking evidence-informed research, aiming to practice in a way that is upstream and focused on health outcomes. In this presentation, we discuss the use of MDIs versus nebulizers in pediatric patients. In the pediatric population, nebulizers and MDIs are indicated for respiratory exacerbations such as asthma. In the hospital, nebulizers are the standard method of delivery of inhaled drugs. Nebulizers do not require high patient compliance and provide consistent administration. However, patients should be discharged with MDIs as they are portable and can be self-administered. MDIs and nebulizers are found to be equally as effective. The use of MDIs at the hospital can encourage families to use MDIs at home, possibly avoiding unnecessary emergency department visits. The use of MDIs also encourages self-administration and to build confidence in the pediatric population. The shift practice allows healthcare providers to educate, advocate, and empower patients and families.
So here we're going to be demonstrating how to use a metered dose inhaler or an MDI. We're going to start by removing the cap from the inhaler, holding it upright, and shaking it. Now we will prime the inhaler and attach it to the spacer. We remove the cap from the inhaler, have the patient tilt their head back, and breathe out. Now we will have them breathe in slowly while pressing down on the inhaler. Breathe in for 3 to 5 seconds, and remove the inhaler and have them hold their breath for 10 seconds. We can repeat as needed, waiting 1 minute in between puffs. Next, we will be demonstrating how to use a nebulizer. We begin by attaching the tubing to an air or oxygen source and attaching the tubing to the nebulizer chamber. Next, we will add medication to the chamber and reattach the chamber to the face mask. Now we will have the patient sit upright, apply the face mask, and turn on the air or oxygen. We have the patient take slow, deep breaths, and the process will last 10 to 15 minutes.